I'm Dr. Ann Witt. I'm a family physician practicing breastfeeding medicine, and I'm also an international board certified lactation consultant. Today, I'm going to be talking about lactation consultant primary care team-based visits, primarily in the outpatient setting. A little bit about myself. As I mentioned, I'm practice breastfeeding medicine. I've been in practice. I started my practice breastfeeding medicine in Northeast Ohio approximately 15 years ago. And in that practice, we're providing specialized breastfeeding care to families who are having difficulties, with the most common reasons families being seen are pain and low milk supply. My practice also provides the lactation breastfeeding support for primary care pediatric visit practice, where we have the standard set that all breastfeeding families, their first visit after hospital discharge is scheduled with the lactation consultant and then precepted by the physician. So the physician comes in to evaluate such concerns such as latching difficulties or weight loss or jaundice. And if those difficulties are happening, we need to address jaundice and weight gain, then the lactation consultant is there to provide the breastfeeding support. And if things are going well, they're also able to provide a bunch of anticipatory guidance. In addition, I have started a website called Primary Care, BFMed Primary Care, and the goal of this site is to provide support to primary care practices that are looking to improve their outpatient breastfeeding support. It's a combination of both physician education as well as kind of the resources on how to provide some team-based care. And that is based on my experience in providing the support for this pediatric practice. So with that, today we're going to talk about team-based care in general, and then specifically how it applies to providing outpatient lactation support for primary care practices. Team-based care is a model of care in which healthcare professionals work together to accomplish the shared goals in the care of the patient. It allows for a more comprehensive approach where each team member brings a unique set of skills and knowledge. The Institute for Healthcare Quality of Improvement and a paper called The Core Principles and Values of Team-Based Care has outlined some basic principles of what team-based care is, and it includes the need for shared goals, effective communication, clear roles of the members involved in the team, mutual trust, as well as having measurable processes and outcomes. Now, when we want to focus this back to outpatient breastfeeding support, team-based care is an opportunity for us to expand support during a critical time, specifically in that first week postpartum after a hospital discharge. A lot of efforts have been done with the Baby-Friendly Hospital Initiative and public health initiatives to improve breastfeeding initiation. And now families in that first week postpartum are trying to figure out how to navigate breastfeeding difficulties and where to get that support. And team-based care is one of those options. So when you look at the US breastfeeding rates, this is numbers, data from 2019 from the CDC's 2022 breastfeeding report card, we see that there is a significant initiation with breastfeeding, that in general families do want to be breastfeeding, but then there is a fall off at 6 months, 12 months. And recognizing that in July of 2022, the AAP joined the World Health Organization in recommending that breastfeeding be continuing for 2+ years, given the numerous health benefits for both the breastfeeding parent as well as for the breastfeeding infant, and recognizing that there is a significant drop-off, that the challenge in the United States is with breastfeeding duration and with exclusivity. The Healthy 2030 goals have shifted away from looking at breastfeeding initiation because they met those 2020 goals and focused on increasing breastfeeding at 1 year to 54%. To do that, we need to provide support in the early postpartum to help families navigate those difficulties. There are numerous barriers to continued breastfeeding, and the Surgeon General's call to action outlined what some of those barriers are, including embarrassment, lack of knowledge, primarily of healthcare providers being able to provide the support that is needed, though also the need for education for families about not just the benefits of breastfeeding, but also how to navigate and how to anticipate what their needs will be. Employment and childcare issues, lactation problems such as pain and low milk supply, the lack of access to healthcare services. The social norms are not there, certainly with the move to encourage breastfeeding for up to 2 years. We've had numerous questions from families about how to breastfeed a toddler because many people haven't seen others breastfeeding longer. And so the support is needed as we change some of those social norms. And just the barriers are also of family and social support. If someone in your family hasn't breastfed, you may not have resources, or if members of your family are embarrassed by people breastfeeding in public, that can also be a barrier for your continued breastfeeding. Now, we can't address all the barriers to breastfeeding, but we as healthcare professionals, there are some unique areas that we can address, including the lack of access to healthcare services, and we can improve that access by providing that access. Lack of knowledge, we have a responsibility to educate ourselves as well as support families in that education, and then help to address lactation problems. And when you're looking at the first week postpartum, you're thinking about pain and low milk supply, our ability to provide instruction on latch or hand expression can go a long way in helping families navigate those difficulties. The Agency for Healthcare Quality and Research has identified some best interventions to support breastfeeding, including improved training, prenatal and postnatal support, and then integrating that within the healthcare system. In terms of training, they recommend structured training for healthcare providers on how to effectively assist, educate families, and actually provide that breastfeeding support. Prenatally and postnatally, when we're looking kind of like the clinical care for breastfeeding, they identify that direct assistance is important, educating and supporting families, providing that, having it occur in a variety of settings, combining the pre and postnatal support is able to, that continuity over time is extremely beneficial, and the importance of peer support and having support within the community. And then there's even an added benefit if it's integrated into the systems of care. Overall, they say that the goal is for comprehensive care from a variety of providers, whether it be peer counselors, nurses, lactation consultants, midwives, or physicians, across a variety of settings, both the clinic setting, the home, hospital, and community, and then a variety of levels of structure and format. So how do we address outpatient breastfeeding needs, specifically looking at those barriers such as support, access, knowledge, and lactation difficulties? I am particularly going to target this discussion towards the outpatient breastfeeding needs. So recognizing still that their support is needed prenatally. In general, if a family has established that intent to breastfeed prenatally, then they're going to initiate at hospital. Well, what happens after discharge? So saying a family did get far enough to initiate breastfeeding, what happens afterwards, and what is the support that is available? How can we address these barriers? The traditional model is that the initial newborn visit is scheduled with the primary care provider, and then if there are difficulties, they were referred out for lactation support. However, there is a lack of continuity and availability. There is not typically integrated support within well visits. It can also result in disjointed care. The primary care provider may be saying something else, referring out to the lactation consultant, may have a different opinion. It's not uncommon for me to see families saying, well, I was told one thing by my primary care provider, one from my lactation consultant, one from another lactation consultant, one from a different family member. It gets confusing to families, the differing opinions. And then it's often delayed access. They don't get the support when they need it right at that day. It could be a couple days before they're seen again. And a lot of times, especially in those first week, the timeliness of care is really critical to prevent premature weaning. So in the team-based model of care, we're proposing, in terms of an outpatient model, that the lactation consultant and primary care provider see the newborn at the initial newborn visit after hospital visit. And so we're building in breastfeeding support with the primary care provider. It's an integrated approach. It's comprehensive. It expands access to families to train lactation providers, and it provides a common message. So we're looking back at those principles of team-based care. We have shared goals. The goals with both the lactation consultant, the family, and the primary care provider are to improve breastfeeding access, to support, to help families meet their goals, and in general, just improve the health outcomes of both parent and child. There are clear roles in team-based care that different members have different roles and responsibilities, including providing assessments, interventions, and follow-up cares. So in lactation consultant primary care breastfeeding support, we have the physician or advanced healthcare provider, as well as a lactation consultant. And there can be other members on this team, kind of just matches what your practice needs are and what the availability of individuals are. The physician or advanced care provider, the primary care provider is going to be providing continuity of care, preventative medicine, and in general, that's the medical home. So that's the place where we want to be supporting a message of what we think is important. And breastfeeding is one of the most effective preventive measures for both the mother and the infant that we can provide as PCPs. It's really important that we have a message supporting that. The lactation consultant training specializes in the clinical management of breastfeeding. They are trained to assess, diagnose, and manage breastfeeding difficulties. So ideally supported to have that support at those visits. There can be other members as part of this team model. There could be a nurse or a dietitian or a mental health care provider. There could be community health workers or peer counselors that are available. It really depends on the need and the availability within your clinic and practice setting. Additionally, mutual trust is important. And this is where kind of having a common education knowledge of both the primary care provider and the lactation consultant, that they are both aware of where their overlapping care is, so they are communicating effectively. And that they trust what one person is going to say in the room is going to match what the other person is saying. And that gets into that effective communication. It is really essential for providing comprehensive team-based care to families. And then the importance of measurable processing and outcomes. And in this setting of team-based breastfeeding support, we are going to be looking at access. So kind of being able to measure, are our families having access to the care when they need it? Are patients satisfied with that care? How do the breastfeeding or the rates of practice improve? And is it a sustainable model? And this is where kind of billing and insurance comes in, or grant funding or whatever. You need to make sure that this model is sustainable. In general, in the first week postpartum, breastfeeding families need follow-up 1 to 2 days after discharge. This is recommendation as per the American Academy of Pediatricians and Breastfeeding Medicine. At that visit, you're going to be monitoring weight and jaundice, kind of in terms of objective outcomes, also providing breastfeeding support, and then following up on any other medical concerns that could become from hospital discharge. In terms of breastfeeding support, what is needed is evaluating if there's appropriate weight gain, that the baby is latching effectively, that pain has been resolved, that it's not uncommon at this visit that engorgement is peaking at this time, so families need support managing engorgement. And also evaluating milk supply. That gets into the appropriate weight gain. If there's appropriate weight gain, you can garner there's probably appropriate milk supply. But if there are concerns about weight gain, we got to make sure that we are establishing the foundation to improve in milk supply. And just in general, early support is critical to resolving difficulties so that families can meet their goals. If there are concerns for infant weight and jaundice, we need to evaluate and support breastfeeding. Yet in general, it's a very time-intensive process, and it is the primary care of the role of the lactation consultant. That's their training to do that. And so having that skill set built into your practice is providing those resources. So in general, with team-based breastfeeding support, we have built-in better breastfeeding support. Families are already seeing their primary care providers 1 to 2 days after hospital discharge to evaluate the baby's weight and jaundice. So we have that built in. Both the lactation consultant and the PCP have a shared goal to support breastfeeding. PCPs in general need more time and breastfeeding training. Having a partner there in the office is showing to families that they think this is important. Over time, PCPs are going to learn more and more by having this shared care with lactation consultants. And all this is going to improve access by utilizing an already established visit. It provides continuity and reinforcement in the community, your community where your practice is. You are building in the support, so it's already built in, so families don't have this disjointed care. It benefits both the family, the primary care provider, and the lactation consultant. And in general, we just need to collaboratively improve breastfeeding support. And that is what some of our research has shown. So in the future, I'll be going over some of our research. This are the 3 studies we have done on team-based lactation consultant. One is done in the suburban pediatric practice where my practice is based. Then we also looked at how we could model this care into a different practice setting at a federally qualified health center, and looked at some of the general principles to help practices evaluate how to implement this care. If there are questions, please go to the BF Med Primary Care website. There's blog postings and just information in general about the foundations of team-based care, and we're putting up new resources all the time. Here are some other references that I've used in making this short video. And just in general, thank you. Join our email list so you get updates as we add in new resources, and follow us on LinkedIn. Thank you very much.